July is National Minority Mental Health Awareness Month, and Intermountain Healthcare, the sponsors of this next segment, are focusing on mental well-being for diverse populations. So Letitia Morgan with Intermountain Healthcare is here to tell us more and educate us on this topic. How are you?
I'm well. How are you doing?
I'm good. Good to see you again. Last time we were in the actual behavioral clinic, but now you're here.
Yes.
So just tell everybody what you do specifically for Intermountain Healthcare.
So I'm a licensed clinical social worker, part of our mental health integration team, where we provide individual and group therapy. Also, we have psychiatric nurse practitioners that provide medication management for our clients.
Amazing. And why is it so important to have a national month for minority, in particular's mental health awareness?
You know, to really raise awareness and bring more education, because we find that the disparities in these groups, it's the more you know and the more that it's put out there, we can break those stigmas, and it really helps them say, okay, it's okay for me to come in, or this is available for me.
Absolutely. And how is Intermountain Healthcare helping this cause?
So we just recently opened up a new clinic on Cheyenne, and it is dedicated to behavioral health. We'll also provide primary care there as well, but we're looking at the whole person. We're not just addressing their physical health, but we're also addressing their mental health.
We saw some footage of you guys in the offices. You know, when someone wants to come in, what's the process like with you guys?
So they're usually referred to us by their primary care provider, or they can be a self-referral.
Okay.
Once that happens, we do an intake with them, and we go through and kind of identify what the needs are. And we either refer them to medication management, or we address it as the therapist.
And if someone's watching who has been struggling with their mental health, you know, what are some of the signs that they should look out for?
You know, when you're struggling with mental health, things change in your habits.
Yeah.
You become more isolated or withdrawn. So people should just really take a note of what's happening with their friends and families. Did something change, or they're a little bit more quiet than normal?
Okay, and with all the things going on in the world, you know, in the minority communities, consuming constantly this news and violence, injustices, you know, that doesn't help either. So how do you suggest people deal with that at home?
You know, taking a moment to take a break. Sometimes disconnecting to just kind of get in touch with yourself.
Yeah. And
really taking self-care is really important during this time. It is vital, really, for you to kind of disconnect from social media.
Absolutely.
And to come and speak to someone. It's really nice to talk to someone who's not connected to the things that you are looking at.
And those social determinants, really quick to end the segment, just list them off so people understand.
Yes, so that's your housing, that's your food insecurities, your access to health care, transportation. So those are things that we also address at Intermountain to help break these barriers.
Perfect. Well, thank you so much for what you at Intermountain Healthcare does for the community. Thank you again for sponsoring this segment as well. For more information, just visit intermountainhealthcare.org/Nevada.